Chapter 4. What is happening in my brain to make it hurt? A migraine headache occurs when the electrical impulses in the brain become uncontrolled and no longer function properly. There are many phases of a migraine, just as there are many phases to a storm. Different symptoms may occur in each phase. It's important to understand the phases of a migraine in order to understand how to feel better. Just as with a storm, there is a build-up stage in migraines during which people can tell if they have a migraine coming before the pain actually begins. This stage is called a prodrome. During the prodrome, people may notice food cravings, mood changes, fatigue, difficulty thinking, or even yawning. These subtle symptoms are likely caused by temporary changes in the electrical impulses deep within the brain. During this stage, it may be possible to prevent the headache with rest, relaxation, drinking water, and distraction. Like a storm that gradually builds up and rain begins to fall, the migraine process continues to build as the nerve cells become more unstable. At this point, some people may develop an aura. Auras happen in about 1 out of every 6 people with migraines. These auras are usually visual and can be scary and hard to describe. Rarely, the auras can also include other changes such as numbness, weakness, or speech problems. These temporary auras are not damaging to the brain. Similar to storms having a stage where rain falls hard and lightning and thunder begin, the next stage of a migraine is the headache phase. This is probably the phase most people are familiar with. During this phase of a migraine, all the nerve cell disruption that has taken place sets off a chain of events that leads to activation of pain receptors on the outside of the brain. The pain receptors are set off by incorrect electrical impulses, not actual damage. It's important to try to stop the headache as soon as this pain begins. Otherwise, the migraine will continue to spread and start several different symptoms if not stopped early. Sometimes resting, drinking water, eating, or sleeping can stop a migraine. Other times, over-the-counter medications, such as ibuprofen or acetaminophen, can help. If these options do not work, a doctor may prescribe migraine-specific medications called triptans. Be sure to limit the use of any medicines you take to stop your headache to less than 10 days a month. Taking these medicines any more than 10 times per month may increase your risk of developing more frequent migraines. Most people with migraines know what will happen if the migraine headache is not stopped soon enough. Some may develop intense nausea and vomiting. Others may want to avoid lights, noises, and smells. The pain can become throbbing and worse with normal movements. Sometimes it can hurt just to touch your head, brush your hair, or even lay your head on a pillow. Sinus pressure, neck pain, dizziness, and blurred vision can occur as well. At this point of the headache phase, the migraine storm is in full action and can feel like it will never end. The migraine pain can last for hours to a few days. Rarely, when it lasts longer, it is called status migrainosus. Often, people become afraid and frustrated when the pain takes over. They may cry or yell. These reactions can actually make the migraine stronger rather than helping to calm the brain back down. This is why stopping a migraine requires more than just medication. The best way to stop a migraine is to also learn relaxation techniques that work directly to calm the disturbed electrical impulses. Finally, similar to storms that have a phase in which the storm begins to wind down, migraines have a post-drome phase. Sometimes this is also referred to as a migraine hangover. People may experience fatigue, nausea, and difficulty thinking during this phase. Once the post-drome is over, the brain returns to its normal resting state, unchanged and undamaged.